Good evening, everybody. Happy 2025. Welcome to the Ensuring Lasting Smiles Act update for the 119th Congress. We're glad you're all with us. If you joined us last week, we're sorry for all of the technical difficulties we had. Hopefully we won't have them tonight. But I just wanted to, again, thank you for taking the time to be with us. I'm Becky Abbott. I'm the NFED Director of Treatment and Research Advocacy. I'm also the co-chair of the NFED Family Advocacy Committee. I have a son affected by XLHED, and I'm also the Wisconsin Advocacy State Lead. Kevin?
Good evening, everyone. My name is Kevin Koser. I've been on the NFED's Family Advocacy Committee with Becky for about 6 or so years now. I'm from Virginia, just outside of Charlottesville in Central Virginia, and I have a 9-year-old son also affected by XLHED. And I'll show you a picture a little bit later of him because there's an anniversary coming up, but I'll talk about that in a little bit.
So I just want to take a minute and just give a shout out and a thank you to several different groups and people who have made this entire advocacy initiative successful to date. First of all, I want to thank Kevin for all the hard work that he's put into moving this incredible legislation forward. I wanted to thank the NFED staff and the board for all of their support. It really does take a huge village to be able to move federal legislation forward. To all of the ELSA advocates, no matter if you've been on Capitol Hill once, twice, or just sent an email or used a web tool, thank you so much for advocating for this legislation. I want to thank all of the supporting organizations, the ELSA Coalition, and especially our bill leads. We have 4 amazing bill leads. 2 of them will be leaving us now that we're in the 119th Congress because they both retired. But I want to give a shout out to Senator Baldwin of Wisconsin, Senator Ernst of Iowa. There are 2 Senate bill leads, and then also Congressman Ferguson. And then a special shout out to Congresswoman Eshoo and 2 of her staffers who are Jordan and Aisling. They did an amazing job getting the Ensuring Lasting Smiles Act passed in the House in a previous Congress, and without them, we would not have had this success. So we're just really appreciative of everybody who supports ELSA, and we're really thankful that you've joined us tonight. Kevin? Did you want to say anything quick?
Yeah, I just want to say thank you again especially to the outgoing House leads, Congresswoman Eshoo and Congressman Ferguson. It's been a pleasure working with their offices over the last 2 years, and beyond that as well, in previous Congresses. So I really appreciate all their work, and I wish them the best moving forward.
So we just wanted to go over a few things. I know that we have a few new advocates on the webinar tonight. So we just wanted to talk about what is ELSA. About 4% of children are born with a congenital anomaly, and ELSA initially would ensure that private, group, and individual health plans would not deny or delay medically necessary treatments of congenital anomalies. Those congenital anomalies are things like oral defects, so cleft lip and palate, hypodontia, and then also enamel defects. It would also cover vision defects such as congenital cataracts and aphakia, and then also hearing defects such as hearing loss from microtia. ELSA, of course, is federal legislation that's broadly written based on the 50 state statutes that require insurers to offer coverages for medically necessary repair of congenital anomalies. And one of the main points of this legislation is instead of insurance companies, it would allow the treating physician to determine the medical necessity. I've had a lot of people reach out recently asking about why we need federal legislation. And the reason is that we already have those 50 state statutes in place. And those state statutes do not cover the 2/3 of Americans who have self-funded plans. Self-funded plans are federally regulated, so we need to make sure that we pass federal legislation that will close loopholes so that all Americans will be able to get this coverage because they have self-funded plans. Kevin?
So over the next couple minutes, I wanted to talk about the history and evolution of the Ensuring Lasting Smiles Act. This goes back many years, as you can see here, but it goes back even further, several decades, to when the NFED has been fighting this battle with health insurance companies literally for decades, trying to ensure that our families can get medically necessary treatments for the repair of their congenital anomalies. Over the last 6, 7, 8 years, we've learned that this is not limited to just the ectodermal dysplasias community, right? There are numerous other health conditions and body parts that are affected where health insurers wrongly deny medically necessary treatment. But what you see on this slide is when ELSA was first introduced. This goes back several Congresses, and a Congress or congressional session is blocked off into 2-year increments. So you can see on the far left, it was first introduced in August of 2018, which was a milestone for the community to get this bill into the US Congress. It was at the very tail end of the 115th. So it didn't really get any progress, but it was a landmark nonetheless. As we transitioned into the 116th Congress in 2019 to 2020, you can see a lot of activity. It happened rapidly. It was reintroduced in February of 2019. We held our first Day on the Hill event in July of that year. Several months later, at the beginning of 2020, there were a couple actions taken in the US House. The Energy and Commerce Committee held a health hearing, and it's actually the 5-year anniversary of that hearing tomorrow. So, I mentioned I had a photo of my son. This is Canon 5 years ago. It's going to be hard because it's on my phone, but yeah, you probably can't see that at all. But anyways, he was only 5 years old at the time. And we were super excited to go up to the Hill to testify for this hearing. We had a lot of support, a great amount of in-person support. That's where we met Congresswoman Eshoo, who would later become our House lead. There was a lot of support for the bill at that time. In the subsequent months, there were a couple big milestones achieved. We got it on the U.S. House consensus calendar, meaning we had achieved at that point 2/3 of the U.S. House as co-sponsors. The Energy and Commerce Committee also held their first health markup for the bill, and Education and Labor also held a health hearing about ELSA. So there's a lot of activity in the first months of 2020. What else happened in 2020, right? We don't like to talk about it. It's unfortunate, but the COVID pandemic, it derailed numerous things, but that also included ELSA. We had to transition to virtual advocacy, so we held our first virtual Day on the Hill in June of 2020. The number of legislative days where the US Congress was actually in session was dramatically reduced. It stonewalled a lot of really good legislation, to include ours, unfortunately. So by September of 2020, Energy and Commerce had done everything that they had to do through the committee. They referred it to the full US House for a vote, but ultimately in those final months of 2020, nothing happened on that front. So we transitioned to the 117th Congress. That's 2021 and 2022. New Congress, so the bill had to be reintroduced again. We had a couple of new members, right? So we had lost some House leads. This is when Congresswoman Eshoo and Congressman Ferguson first came in and took over the bill for us. In the House, we held another virtual Day on the Hill. Again, we achieved the consensus calendar, meaning again, 2/3 of the US House had co-sponsored it by February of 2022. And 2 months later, the biggest milestone for ELSA, it went to a full vote in the US House, and it ultimately passed with just over 75% support, 310 yeses to 110 noes, which was gigantic. It was truly a testament to all the advocacy that the organizations and you as advocates have been doing over those years. We went into another virtual Day on the Hill, trying to generate additional support and actions in the US Senate. Ultimately, the Senate had unfortunately failed to take action before the end of the year, despite our best efforts to try to get it into an end-of-year package. And as a result, we had to start over in the 118th Congress. So that's 2023 and 2024. And here, it might look like not a lot was going on, but let me tell you, there was a lot happening in the background. So obviously we held 2 different days on the Hill in person, which was great to see everybody in DC for those advocacy events. During that time frame from the end of 2022 through the end of 2024, our 4 bill leads were working furiously amongst each other with committee leadership, with House and Senate leadership, to really discuss the bill and figure out what is the best path forward. There were a lot of reasons. You can see that there were 110 no votes in April of 2022, so there was some opposition. They gave various reasons, and the bill leads needed to address those reasons to ultimately find a bicameral solution so it could move forward. What we have recently learned, and you can see in September of 2024, the 4 bill leads had tentatively agreed to revise the scope of ELSA. It is a narrowed scope. I'm going to address that in a couple slides when we talk about the next steps and finalizing the text. I'll discuss that in a little bit more detail. But here we are now in January. I should say 2025. That is my typo. I'm sorry about that. I forgot that we are in a new year. My body still feels like it's 2024. But we'll kind of talk next steps for this 119th Congress. So what is the 119th Congress? They were just sworn in. They just took over their new jobs. And as you can see, there was a lot of turnover. This is typical, right? Every 2 years, there are elections. The entire US House comes up for re-election every 2 years. And about 1/3 of the US Senate comes up for re-election every 2 years since they have 6-year terms. About 15% of the 119th Congress is new, and these cover across 31 states or territories. Several members have joined in the late 118th Congress, so it's even more than 15%, right? So relatively newbies, even though they had just taken over in the late 118th. There are 12 new US senators, 65 representatives. You can see pretty even split across parties, 38 Republicans, 39 Democrats. But also, ultimately, this final bullet, I think it's really important that Congress is aligned, right? We have a Republican Senate, we have a Republican House. This has not been the case since the 115th Congress in 2018. So going on 7 years ago. This is important because for the last couple of Congresses, we've been trying to thread a needle, and it's very difficult in politics to do that, between whether one chamber was Democrat and one was Republican. And due to hyper politicization of our country in the last couple of years, it's really difficult to get anything through, especially a healthcare bill. Healthcare is a really tricky subject to tackle. So, while I think we have some optimism here that Congress is aligned, we can try to achieve something here. So we'll talk about that in the next step. Another couple of fun facts and interesting facts that are really important for the 119th. The U.S. House, I'll start there. The current slate is 220 Republicans to 215 Democrats. It is a razor-thin majority in the U.S. House. Ultimately, by the end of this month, it's very likely to drop to 217 Republicans to 215. So a 2-seat majority, as a couple members, number one has already resigned from Florida, and then 2 additional Republicans might be moving into the new administration, taking over, and therefore having to resign their seats. It's a razor-thin majority in the House. On the Senate side, it's again Republican dominant majority. It's 53 Republicans to 47 Democrats, but still, that's far from the traditional 60-seat threshold that's historically been required to move a final vote for legislation on legislation. There are other mechanisms where it requires a simple majority, meaning 51 votes, but that's typically reserved for large packages and sometimes very partisan priorities. So we don't expect that to apply to ELSA here. Most of the House and Senate leadership from both parties will remain the same, except for the Senate. Senate Republicans are now led by Senator John Thune of South Dakota. John Barrasso from Wyoming is his whip. That's the only real significant change in the leadership. There has been some movement from the House to the Senate, so that's something to keep in mind as you're looking at your members and who represents you in the Senate. There are 7 members who were in the U.S. House this past session who moved up to the Senate side. Some of them had cast votes on ELSA as a House member. So that's important to look at when you're researching who your member is. A couple fun facts. So there are 8 House members who were born in the 1990s. The youngest was born in 1997. It's crazy. So I think he's 27 going on 28 years old. There are 5 new physicians who were just elected. That brings to a total of 26 healthcare or medical professionals who are in the 119th Congress. 4 of them are dentists. 4 of them are in the Senate, but the rest are in the House. Some very common last names. Again, as you're researching your member, something as simple as this is really important. Make sure you're looking up the right member. Last names that are very popular: Moore, Johnson, Scott, and Smith. There's 5 of those each. There's some really interesting backgrounds from some members: scuba instructor, economic policy advisor to the Dubai Crown Prince, Hollywood film executive, an actual lottery winner, lottery jackpot winner in California, Gil Cisneros. Won a lot of money about a decade ago, so good for him. That's great. But all that to say, it's really important, number one, to get to know who your members are. Do take your time, research your U.S. House of Representatives, research the U.S. senators. This gives us a really important and incredible opportunity to build these new relationships and try to work together across the aisle, both Democrats and Republicans, to get this bill passed. We have always been a strong bipartisan bicameral bill, and we intend to remain that, even in a Republican-dominated Congress.
I'm going to add 2 quick things. One, if you have any questions, enter them in the chat, and we'll answer any questions at the end of this webinar. And then also, Greg is going to be putting a link to our website that you can enter in your address to find your new legislators, or if you just don't know who your legislators are, it's really easy. Just enter your physical address and the website will find them for you.
All right, so next steps, and I'm going to ask Becky to fill me in if I miss anything here. So we're at the beginning of the 119th. We've got 2 years until the end of the 119th. Our ultimate goal is to have ELSA signed into law by January 3rd, 2027. So in order to do that, here are things that we have been doing and will continue to do. Number one, we need to find new House leads, both a Republican and a Democrat. We are working very strategically and working with our outgoing leads and the outgoing staff to identify prime members who would be willing and able to move ELSA forward in a meaningful way. We need members who are passionate. We need members who have key access, whether it's on committee or House leadership positions. We need to make sure that we choose the right people to advance our bill. So that is issue number one, and that's something that Becky and I and NFED and others are working very closely on, and we'll continue to update you as we make progress on that front. As we do that, also happening in the background, primarily, obviously, starting with the Senate side, is we're working on finalizing the draft of ELSA, right? So I alluded to the changes in the scope. So let's talk about that real quickly. As originally intended, ELSA was meant to cover the medically repair of any congenital anomaly so long as it was medically necessary. There was discussion, active debate, and even opposition to ELSA that generated in 2022 during and after the U.S. House vote. As a result, and looking at the realities of the political landscape, our bill leads in the 118th decided to narrow the scope of ELSA. This happened in the last couple of months, and it's something that's still actively being discussed. But I will let you know that as of now, the most likely consensus is that ELSA would apply to congenital anomalies or birth defects that primarily affect the appearance or function of the eyes, ears, teeth, mouth, or jaw, right? So eyes, ears, mouth, teeth, or jaw. That addresses a large block of opposition that we had in 2022 and has lingered since then. It addresses other issues in terms of cost as well. It's going to be a lower cost to the federal government with a reduced scope. And the fact of the matter is, it's probably the only feasible way to move ELSA forward in the 119th Congress is through a reduced scope. So that's what we're operating in now. We're going to continue engaging our bill leads in both the House and the Senate. Once we identify the House leads, make sure that that's still a consensus among the four leads, and we'll move on from there. So for you all, right now, it's really important to know who your legislators are. Everybody has 2 US senators and 1 representative. You need to know who they are, not just their names and their political party, but you get to know them, right? I was listing off some fun facts, some stuff about physicians, new physicians coming in, right? It's important to know if they have a medical background, because then you can talk to them on a different level about the issues that you all are having with health insurance. Maybe they relate to that. Research them, get to know them. They are people. We need to treat them as such, right? We need to be respectful, and treat them as people. Introduce yourselves to the offices, build relationships with them, whether that's the staff or the member themselves, but ultimately the staff are a critical component. People who you will be communicating the most with, their health legislative aide, the legislative director. Sometimes you can meet other staff members as well, the schedulers, et cetera. Be nice to all of them. This is their full-time job, career for many of them. Get to know them as well. Our intent is once we are ready to start sharing a draft of the updated ELSA, which again, it's still being discussed with their 2 Senate leads, and then once we identify the new House leads, it'll have to be finalized and blessed off on by them. We will ask you to ask your legislators to become original co-sponsors. An original co-sponsor is one who pledges support for the bill, and his or her name will ultimately be added to the bill as somebody who reintroduced it along with the 4 bill leads themselves. So it's a big step. Their name goes on the bill. It's really important. This is something that happens before reintroduction of ELSA. Then, of course, we'll have it reintroduced, hopefully with a large list of original co-sponsors. And even if you don't get them on as an original co-sponsor, maintain that relationship, continue reaching out to them and building that relationship, because they can become co-sponsors even after it's been reintroduced. So again, we want to get as many co-sponsors as possible. That requires education, teaching them about the conditions that you all are facing, the health insurance issues that you are facing. And that should lead into what we call the legislative process. That's hearings and committee action. So we talked about Energy and Commerce and Education and Labor Committee hearings that happened back in 2020, right? So we want that to happen again this year, which will allow the House and the Senate to vote on the bill, allowing it to get to the president for signature and being signed into law. Implementation is a big aspect. A lot of the text changes that are being discussed right now are dealing with implementation of ELSA. There are new laws that have passed over the last couple of years that are affecting the healthcare industry. One of them is the No Surprise Bill or Balanced Billing, No Surprise Billing Act. So that's something that our bill leads are actively addressing, trying to figure out how does ELSA navigate this new landscape of health insurance regulations, make sure that we're not going to be contradicting any other pieces of legislation or law. So that's a lot of the discussion amongst the bill leads. Becky, what am I missing here?
The only thing I was going to mention is that a lot of advocates have asked for an easy way to raise awareness for ELSA and find a way to easily share our web tool. So we've created a QR card that's easily shareable. You can take a screenshot of it, you can share it via email, and then anybody who you run into, you can have them scan that QR code on your phone and it automatically takes you to the web tool where you would enter in your address and advocate for ELSA. Everything is pre-populated, so all you have to do, you can add your personal story. You can add, if you're a clinician or a doctor, you can add your patient story and then send it, and it only takes two minutes to send it. So I would just say keep that in your back pocket or on your phone. And anytime you reach out to anybody and you want to raise awareness for ELSA, bring that card up, and it's just a really easy way to advocate. Anything else there, Kevin?
No. Obviously, I'm open to questions at the end. So if feel free to keep typing in your questions. I know I went through a lot there.
So I'm going to talk just a little bit about grassroots efforts and success. All of our success has been due to mindful advocacy and patient stories. As Kevin said, we're starting fresh. This is the beginning of the 119th Congress. We have 2 whole years to get ELSA passed. But we've heard over and over again that patient stories have driven support and awareness on Capitol Hill. And that's exactly why ELSA has been successful and how we've been able to garner so much support for healthcare bill. Kevin alluded to the point that healthcare bills are very hard to get passed, and we're no exception. As everybody knows, this has been a very lengthy process just by that timeline. It gets to be exhausting just looking at that timeline, just to think about all of the work that we've done. But we've been very successful because of the way we've advocated. This has always been about patient stories. This has been about sharing our stories from the heart alongside the professional organizations who are advocating on behalf of their patients. So I just wanted to quickly recognize we have about 70 plus patient and professional organizations that are supporting and advocating for ELSA. Those are our ELSA supporting organizations. We have a smaller ELSA coalition that's made up of part of the 70 plus patient organizations who are really have made ELSA a priority and stand beside us to try to get ELSA passed. We have ELSA advocacy state leads, and we're going to be making that program a little bit more robust in the 119th Congress. So if you're interested in becoming a state lead, please reach out to me and I'd be happy to share information. We also have our advocates, and we have our sponsors, which I want to thank, and then also our bill leads and the staff that support us in the bill lead offices. So I just want to say thank you so much. We have this picture here of Ash, and there's a quote here from his mom, Mary Beth. She's an amazing advocate. And the reason why I left this here is because Mary Beth and all of the advocates who share their stories are exactly the reason why we have been so successful. Each and every person's story that is shared on Capitol Hill is so important. Everybody has a voice. It doesn't matter how old you are. If you've done this before, everybody needs to advocate. And Kevin and I are always here to help you and explain exactly how to advocate. Sorry about that. So we need everybody to advocate. Advocates have cultivated lasting relationships with hundreds of members of Congress, both past and present. And as I mentioned, our mindful grassroots advocacy is the only reason that this bill has remained bipartisan throughout the whole advocacy initiatives journey. So again, this isn't a Republican bill. This isn't a Democrat bill. This is a common sense bill that's life-changing. And that's why we've garnered so much support. So I just want to remind you, as we move forward, please be persistent, positive, patient, and passionate. Kindness makes all the difference. As Kevin said, staffers, bill leads, they're all people like us. They may even have family and friends that this legislation would possibly help and benefit. We want to make sure that we reach out to them and we want to educate. We don't want to argue because that will completely cause issues with different offices if we argue with them. And I know it's hard to do. There are some times when a staffer or one of the legislators makes a, comment and you just want to argue with them because you're so passionate about it. But I mean, take it from me. Don't argue, just educate, give them the facts. Let offices know that you look forward to hearing from them and that you'll be a resource for further info. And please share updates on ELSA as we have them. So once ELSA is reintroduced, make sure you let them know, oh, it's been reintroduced on this day. We look forward to working with you in the future. There are thousands of pieces of legislation introduced every year, and you just need to explain why ELSA should be a priority for that office. With very mindful, thoughtful advocacy, we've been able to get people who have said they'll never co-sponsor ELSA to vote yes for ELSA. So don't ever get frustrated because you never know how that person is going to vote. Make sure you tag your legislators in a mindful educational social media posts. Don't post something negative and then on the flip side, ask them to support ELSA because it looks really bad and we want to make sure that we are being as kind as possible. I just want to mention that ELSA is more than legislation. It's really a platform that has allowed advocates from all different communities to raise awareness for their condition, share their story, become empowered, and then fight for change for this underserved community. And we're just really appreciative to all of the advocates who have really fought alongside us to get this legislation passed. So I just want to remind you that we have the Ensuring Lasting Smiles Advocates group on Facebook. We would recommend that you join that. And then here's our email addresses. And we will take questions at this time, unless you have anything to add, Kevin.
Nope. I'm ready for questions. I'll go ahead and I'll read the first one. It seems like there's some questions about acronyms. I see they were answered in the text. If there's any other questions on those acronyms, feel free to reach out. But it seems like they were addressed in the text there. All right. From Brian, how long will it take to get the House sponsors identified and the bill introduced? Is the language drafted and ready to go? Ultimately, we don't know right now. The goal, at least of the remaining two bill leads, right? We've maintained two in the Senate, is to get it introduced as quickly as possible in the 119th. What does as quickly as possible mean? I can't define that, unfortunately. If you recall from the timeline, I think other than the 118th, which was an anomaly, in the 116th and the 117th, we had it reintroduced by February or March, right at the beginning, within 2 to 3 months of the new session. I would anticipate probably the same. We'll have to see how that goes. In terms of finding the new House sponsors, again, that's an active thing. That's priority one right now. And we are in those discussions trying to identify the right people for that. Once we have them identified, that implies that obviously they've probably already reached out to the existing Senate leads. They have an idea of what the text will look like. But like I mentioned, the text is still very much in draft form. There are some implementation issues that still have yet to be resolved, dealing with surprise billing and right. So like if you're seeking dental care for your congenital anomaly, there aren't a lot of dental providers in health insurance networks, right? So how do you navigate that? It's not a new issue, but it's just one that has come up as a result of new US code. So it's something that our bill leads have to work out. That has not been resolved yet. So the text is not drafted and ready to go yet. We do have a very solid foundation for it, but there will inevitably be some change. So unfortunately, that's a long way of saying we don't know when it will be reintroduced. But our number one priority is trying to find the new House leads.
And both of our Senate bill leads have indicated they would like to try to get it reintroduced as soon as possible. So they are working on this every day. Kevin did mention about some of the text changes being related to implementation. And we're grateful for that. We're glad that the organizations that we're advocating alongside, plus the bill leads, are thinking ahead. Because we really want to make sure that we have a very strong bill and there won't be any issues so that it can be implemented right away. So we're really trying to think ahead to when ELSA is passed and that how we can implement this right away. There's a question about, will it be in both the Senate and the House? Yes, it will be reintroduced in both the Senate and the House. We don't know if they're going to do one before the next, but most likely it will be simultaneously and they'll be introduced at the same time. Is there another Hill Day planned at this time? Not as of today, but that is being talked about. So we will, as soon as we make that decision, we will let you know when that will be, if it'll be virtual or in person, and what that looks like.
I see one in there dealing with how do we overcome or explain the CBO, the cost estimate of this bill to convince co-sponsorship. So the CBO is Congressional Budget Office. They put out a cost estimate of what will a piece of legislation cost the U.S. government. And the cost is twofold, right? Number one is what type of direct spending, how much money will the federal government need to spend to if this bill were passed. And then the second piece of the cost estimate deals with how much money or how does this affect U.S. tax revenue. And there are tax implications for healthcare. So in 2022, it was a large CBO. I think it was estimated at $2.5 billion impact over a decade, meaning it would cost the federal government $2.5 billion over the next 10 years. Most of that, I think it was 2.3 billion, was lost tax revenue. The thought being that as employers spend more money on medically necessary treatments through this bill, that's more tax write-offs essentially for the employer. There'd be less tax revenue coming into the federal government. We've had documents in the past kind of explaining why we think that 2.5 billion is wrong and misleading. The quick answer to that is number one, it's not dynamically scored, right? So this does not take into consideration cost savings. And we do anticipate that there will be cost savings associated with this bill because as most of us know, if your family, whoever received the medically necessary care that they needed at the time that they needed it, at the time that the doctor said, hey, here's our plan, let's pursue this, right? If the insurer approved those claims, you would have less secondary costs, right? So when an insurer denies or delays medically necessary care, other issues arise. And I know there are countless examples of that over the years of like, if you needed bone grafting now to support implants, well, now you're going to delay it by 3, 4, 5 years, which results in higher costs for more grafting or other medical complications associated with that treatment. Unfortunately, the CBO doesn't take that into consideration. That's the number one issue that I think you could use to share with legislators who are hesitant about the costs. But we'll make sure as we get ready to reintroduce the bill, we'll be updating all of our supporting documentation. Usually, what we'll have is a one-page document that has a summary of the bill. We'll have a section-by-section summary that goes into a little more detail on what is included in ELSA. We'll have a frequently asked questions page, and that will get updated, but that will also have some answers dealing with cost savings and why we think CBO is wrong, or at least misleading at this point. And all the offices will receive that as well. All right, next, when can we send letters to our legislators? Honestly, that's up to you. I mean, if it's a new member, I would lean on the early side, right? I think it would be great to get involved as early as you can. Get to know the new member, get to know the new staff, right? We talked about the new staff or the new members themselves in the 119th Congress. There's a lot of them, so they've never been exposed to ELSA before. But there's also lots of new staff, or at least staff that have moved between offices, right? So they may have been exposed and dealt with ELSA in the past in a different with a different member. Now they've moved into your office. Just get to know them. Feel free to reach out, share your story, explain the health insurance issues where they're denying medically necessary care. So yeah, I would say as early as possible, right? We don't have a solid request of those offices at this point because you can say that we anticipate asking them to join as an original co-sponsor, but we're not having a call to action on that yet, right? Because we're not at a place yet where we don't even have house leads identified right now. So we don't want to jump the gun on that. But I would say it's important to get in just to start communication, start dialogue with these offices and the staff members, explain to them, hey, we've got this health bill that it would be life changing for my family or my friends or my practice, and we'd like to talk to your healthcare staff or your legislative director about the Ensuring Lasting Smiles Act, and you can share your story with them.
There's a question here from Anna. Anna, the question that you asked about the wording for ELSA, we're working on that right now. That's exactly what Kevin has been mentioning, especially about implementation. We do understand that providers need to have the tools to be able to provide benefits and provide treatment to families and individuals. So we're working closely with the professional groups and patient groups, as well as our bill leads, to come to an agreement. We don't know what that will be yet, but those are I guess, the nitty-gritty details that we're working on right now, to ensure that providers will be able to provide treatment and patients will be able to get the treatment and they will be covered. So stay tuned and we will address that as we know more. Where is the QR code located? I don't see it on the website. I think Greg was going to put a post in the chat here, but it is on our advocacy resources page, and you should be able to find it there. Next is Max. Due to the rewriting, will ELSA cover treatments to fix breathing, such as coverage for correcting the so there is a clause in ELSA that not only will it cover the congenital anomaly, but it will cover any type of secondary surgeries or treatments that will be needed to fix the congenital anomaly. So for example, in my son's treatment, he would need bone grafting and he would need dentures, or he needed dentures at some point. He would need braces. There's all different things that are stages to correcting the original congenital anomaly. So anything that would be considered part of fixing that congenital anomaly would then be covered under ELSA. Is there anything else that you want to add there, Kevin?
No, that was perfect.
Amber asked, why not reintroduce it in the Senate now while we wait for the House leads to be identified? We don't have the text ready yet. So as soon as the text is ready, then we would like to reintroduce both in the House and the Senate so that we can just get it going at the same time and start getting all of those bill leads in both of the chambers. Next is Beth. No, Beth had asked about reaching out about bill leads. We have to do that very strategically to make sure that the bill leads are in key positions and that they're very passionate about getting ELSA passed, because that's the only way that we're going to be able to move the bill forward. As I had mentioned before, Congresswoman Eshoo was very, very passionate about this. She put in a ton of extra work, and so did her staff, to get that bill to the House floor and passed. So we just really need to make sure that we choose very, very passionate bill leads who will be able to move this forward. Kevin, do you want to take the next one?
Sure. So Ethan's asking, could you elaborate on the changes to the bill text mentioned in regards to only covering care for that ears, eyes, mouth, etc.? Are you selecting specific congenital anomalies to include based on this, or keeping it vague and just limiting coverage of these areas? So the intent is not to list out specific congenital anomalies. That would make it far too difficult, and inevitably we would exclude too many congenital anomalies that may be rare or we haven't heard of, right? So I think at this point, it's to leave it vague to cover those areas only. But again, this text is still draft. It could evolve even further. We just kind of have to wait and see, and we're going to stay engaged, obviously, with the Senate and the new House leads as those discussions happen. Catherine asked a question about how will this legislation help those affected without insurance or self-pay? Becky, do you want to take that one?
Sure. I'm not sure if she's asking about without insurance at all, but if patients did not have insurance, then this bill would not cover them because this is ensuring that insurance companies would pay for the coverage for those congenital anomalies. If they are not a private insurance company or a not private plan, then those would not be covered as well. That would be another step down the road. But as far as self-funded plans, as long as it's private insurance, individual or group private insurance, then it would be covered under this legislation. I think that's what you're asking, Catherine. If not, we can talk offline.
Yeah, and I think Becky, I think this is something that we've kind of discussed. I think we had a kind of an educational seminar a couple of years ago, something virtual during COVID time, but kind of going over like what are the different types of insurance that exist out there. I think that might be beneficial and something that we'll consider in the coming weeks or months to kind of describe again, what is a self-funded plan, what is a fully insured plan, what Catherine's, I think, referring to as self-pay, that's different in the sense that you truly don't have an insurance policy, therefore you're self-paying, but a self-funded plan is different than that. So we can kind of dive into that, what is health insurance and what are the various types, which might assist some people. But like Becky mentioned, this is for the private side. So it does the public side, that includes like Medicare, Medicaid, federal employees, TRICARE, Veterans Affairs, et cetera. Those would not be included through ELSA at this point. We're only talking the private plans at this point, which makes up a large majority of health plans nationwide. And that's why we decided to focus on that initially. Trying to lump it all together, tackling every type of insurance would be extremely way more difficult than it already is, just because the number of committees, right? And all the different loopholes and insurance regulations that we'd have to navigate. So as a result, we're focused on the private health insurance side.
And then, so there was a question about Medicaid and Medicare. So at some point, those could be covered or those could follow suit. But as of right now, just as Kevin said, we are focusing just on the private, and then we'll see what happens in the future. Will it take more than 1 year to identify new house leads? No, we're hoping, I would say, Kevin, probably by the end of the month to have new house leads somewhere around there. It really depends upon all of the committee assignments that we're waiting for. We've been watching committee assignments every day. There's been a couple in just in the past few days. So I would hope within the next month or so we'll have new leads and we'll be able to announce them. And then, as Kevin mentioned before, about getting the text ready, we are hoping to have that done and reintroduced, hopefully, I mean, in Q1. Just like he said, that's usually about when the bills are usually reintroduced. It really just depends upon if we can get the text done, that everybody can agree with it. And there's just an extra step because we're going to be having new house leads. So once we get those new house leads, we're going to have them bless the language so that it can be reintroduced in both the House and the Senate. And that was Brian. You want to take Amber's, Kevin?
Yeah. So just kind of alluding to some downtimes that we had, obviously, in the 118th Congress. And while it seemed like there was a lot of downtime, it wasn't stalling of ELSA. This was truly like lots and lots of discussions in the background where we were discussing with committee leaders, House and Senate leaders, the bill leads themselves, trying to come to some type of negotiation and final resolution on several issues that had been raised. Right, so that type of negotiation and discussion didn't warrant the inclusion of nationwide advocates to jump into the fold. And that's why we had to keep it smaller. The ELSA coalition was intricately involved in this discussion, and they remain so. So we've been working really hard to make sure that all of that's covered. I anticipate obviously the first month of this session, we're still waiting for some resolution on implementation language that several of the participating organizations have brought up, and we're working very closely with this on the Senate side to make sure that happens. There are other organizations involved in the federal government: Health and Human Services, Center for Medicare and Medicaid Services, Congressional Research Service. There's lots of people who have duties and obligations related to our bill, and as the bill gets ready for reintroduction, has to get blessed off by legal counsel. Right, there's lots and lots of steps. Again, that it's not a stalling of ELSA, and it's not something that we're going to have to ask advocates nationwide to engage in. Obviously, we're really excited to get it reintroduced as soon as possible. The beginning of the 116th and the beginning of the 117th, we got it reintroduced within 2 to 3 months. Our goal is hopefully to get it introduced as quickly as possible this session, in the next couple of months at the latest. So all that to say, I don't think there's any need for a contingency plan at this place. We know the path forward. We're going to stay engaged on that path and make sure that it doesn't get stalled.
And then Christina asked, how do you want us to reach out if you're interested in being a state lead? You can just reach out to me, Becky at nfed.org, and I can just explain what state leads do. And then we can also just basically share with you, what you'd have to do. And if you're interested, then we can move forward. Tiffany had asked, what about ACA insurance plans? Are they excluded too? ACA insurance plans, many of those are private, so it would just depend on what type of insurance plan that you would take through the ACA. We do have a lot of information about how to determine what type of insurance you have. So that's something that, like Kevin had mentioned, we can probably share in the future. So, if you have a self-funded plan, if you have a private plan, if you have a military plan or Medicaid or Medicare, because that will determine if ELSA applies to you or not. One more thing I was just going to mention, I just want to thank everybody. I know that this has been a very frustrating 2 years. It has been for Kevin and myself. We've had a lot of deep discussions about how we move forward and what to do, what is best for the advocates and our communities. As Kevin mentioned, there's just a lot of things that have to go into getting federal legislation passed. Federal legislation is a big deal, right? It's going to be the law of the land, and it's going to apply to thousands and thousands of people, their coverage. So we need to make sure that everything is right. We need to make sure that we follow the bill leads steps and that we're strategic about it so that we can get this passed. It's a lot of work, but in the end, when it passes, it's going to be a huge blessing for so many people who are waiting for this to pass. So we just want to make sure that everything is right so that we don't have to go back and edit it or correct it after it's passed, which would be a huge deal. So let's just move forward in the 119th. It's a new year. We're starting fresh. Let's be mindful, kind, and reach out to our legislators, share our stories. You are all amazing. I've pretty much everybody on this webinar, I've heard your stories. Just keep sharing your stories. What I would recommend doing is looking back at your story, make sure that all the information is still correct. If you have information to update in your stories, update your story so that you have it ready as soon as we have the text that comes out. And I'm just asking everybody, please advocate as much as you can in these 2 years. We want to make sure that this bill goes through. I mean, Kevin and I, there's nothing else we would love more in life than to see the Ensuring Lasting Smiles Act passed. We put a lot of time and effort into making sure that everything's right so that this bill will help as many people as possible. So if there are no other questions, I think that's pretty much it. Kevin, is there anything else that you wanted to add?
Just thank you again. Please stay engaged. Reach out to Becky or me. Join the ELSA Facebook page, and just get ready. Like when it comes, it's gonna come quick. So we just want to make sure that you know who legislators are, have your stories ready, and get ready to advocate.
Yep. Thank you, everybody. Have a good night, and we'll be in touch very soon. Thank you.